What would you write for each of these scans? Normal, within normal limits, nothing obvious seen, abdominal ultrasound, nothing abnormal detected. Here's the thing, those phrases sound confident, but often they're not. They're placeholders for doubt. For I didn't see anything, I think, and the words we choose, within limits, detected, obvious, they say more about how we felt than what we actually saw. Detected, for example, really means detected by me. And if I'm not that confident in my skills, it leaves the door open. Someone else might have spotted something that I missed. Obvious suggests you were only looking for the things that shouted at you, and within limits can feel like you're hedging your bets because you're not quite sure where the limits actually are. So today we're asking what makes a great vet report, and how can you go from vague to valuable without needing to sound like a specialist? Stay with me because in this video we'll revisit those scan images you saw at the start, and I'll walk you through how to write them up using a structured, confident approach you can start using today. If we haven't met before, I'm Dr. Camilla Edwards. I'm a veterinary surgeon and the founder of First Opinion Veterinary Ultrasound, FOVU for short. And I help first opinion veterinary surgeons like yourself become more confident, consistent and clear in your ultrasound technique, interpretation, and yes, reporting. At FOVU, everything we teach is built around 4 key pillars: structure, practice, feedback, and report. And that's what turns scanning into skill. Structure gives you confidence, practice builds habit, feedback fuels growth, and reporting adds real clinical value. That's a system, and it works. Today we're digging into something we don't talk enough about: how to turn a scan into a clear, valuable, and accurate clinical report. Because scanning is one thing, thinking is another, and documentation, that's where everything comes together. So what vets say in their reports, and what do they really mean? Let's start with a few things I hear fairly often. I just write nothing abnormal detected unless there's something obvious. Within normal limits, it looked all right, I think. No obvious abnormalities seen. These phrases sound simple, but they actually tell me a lot, not about the scan itself, but about the vet's confidence levels, their stand-ins, not for pathology, but for uncertainty. Let's unpack that a little more. Detected doesn't just mean something was or wasn't there, it means I didn't detect it. And if I wasn't sure what I was looking for or didn't fully trust my scanning skills, that word becomes a disclaimer. Someone better might have spotted more. Within limits implies you're working in a grey zone. These boundaries are fuzzy, so instead of saying something is normal, you say it's not outside the zone of concern. It feels safer, but also signals hesitancy. Obvious means you were scanning for the loud things, the anomalies that leap off the screen. It suggests that if it wasn't glaringly clear, it might have been missed. And again, the subtext is someone more experienced might have picked up on the subtle signs. What's really going on here is something I see all the time: comparisonitis. We all know that ultrasound is operator dependent, but instead of owning that, most vets interpret it as it depends on someone more skilled than me. So when we write vague reports, it's often not just because we don't trust ourselves, it's because we imagine someone else would have done better. These default phrases reflect a cautious mindset, and it's not wrong, but it's worth being aware of what they say about your own sense of certainty, because we are often not taught how to describe what we're seeing. And if you're not sure of what you saw or didn't see, you tend to default to something safe. That's human, that's responsible, but it's not how you grow. And most importantly, it's not how you build trust in your reports. A great report does 3 things. It shows your thinking, it communicates clinical value, and it teaches you every time you write one. Even if your scan was completely normal, a clear, structured report proves that you checked, that you noticed, that you weren't just waving the probe around and hoping. And let's not forget, your report may be seen by a client, a referral vet, or another colleague. They don't know whether you're a seasoned ultrasonographer or someone just getting started. They can't tell what views you got, what you were able to assess, or how confident you felt in your interpretation. But here's what they will subconsciously take from those sentences. This vet probably wasn't sure. We haven't ruled out liver involvement. There might still be something going on. So even though the words are technically fine, they don't inspire trust. A vague report casts doubt, not just on the findings, but on the process. Now contrast that with something like liver normal in size and shape, positioned appropriately within the cranial abdomen. Parenchyma is homogeneous with normal echogenicity. Margins were smooth and well-defined. No focal or diffuse lesions identified. No abnormal vascular patterns or biliary dilatation observed. Sampling not performed. That reads differently. It sounds like you were systematic. It sounds like you looked closely. It tells the vet, this organ has been thoroughly assessed, and here's how I know. They know you took it seriously. It makes them feel confident in your care. And it reminds you that what you did mattered, even if you didn't find anything dramatic. So why do we default to vague phrases? There are three big reasons. Confidence. You're not sure what you saw, so you stay safe. Language paralysis. You don't want to overstate your certainty. And no feedback. You're not getting comments on what you write, so you stay stuck. And then there's a big one that most of us don't say out loud. It just feels like too much effort. The idea of changing how you write reports, especially when you're already busy, can feel overwhelming. You might worry it'll take too long, that you don't have the language, that no one's reading them anyway. But here's the truth. Clear reporting doesn't need to take more time. It just needs more structure. Once you're using a system like Speeds, the words come faster. You're not reinventing the wheel each time. You're filling in blanks with what you've seen, systematically, confidently, and in a way that communicates value. So yes, you might feel like more effort at first, but like any habit, the more you do it, the less mental energy it takes. The more powerful your reports become, not just for others, but for your own clinical thinking too. This came through clearly in discussions I've had with veterinary surgeons about report writing recently. They said, I know what I meant in my head, but that's not what I wrote. Sometimes I just say NAD unless I see something obvious. And this is the key insight. Many of us are afraid of either sounding foolish or sounding more confident than we actually are. So we underreport, we blur the edges. We write something like, adrenal gland appears normal. But let's be honest, appears in that sentence is our get out of jail free card. It leaves the door open just in case someone else scans the same patient later and sees something different. We're not really saying it's normal. We're saying it looked okay to me at the time, I think. It's self-protective, understandably so, but it also waters down the clarity of our communication. So instead, if we write both adrenal glands visualized in typical anatomical positions adjacent to the aorta and caudal vena cava, symmetrical and ovoid in shape, the left measured 0.5 centimeters and the right measured 0.6 centimeters in thickness at the caudal pole. Parenchyma homogeneous with normal echogenicity. Margins were smooth and well defined. No evidence of regional asymmetry, mass effect, or mineralization. Sampling was not performed. Even if you weren't 100% sure, you've now created a record of what you saw and how you interpreted it. That's valuable, not just for the case, but for you. And in a moment, I'll show you how FOVU Report helps vets to do just that. Let's take a moment to flip things around, because not all short reports are written from doubt. Sometimes they're written with too much confidence. You'll see phrases like no abnormalities, liver unremarkable, adrenal glands normal. But then you're left with the question, were those structures actually seen, properly interrogated, described in any detail? Over time, we sometimes learn to sound confident without really checking our processes. Speeds protects us from that. It forces us to slow down, prove what we've seen, and say how we've got there. So our reports don't just sound confident, they are confident. So let's get clinical and look at some examples. We'll look at what vets might write in these situations and how we can turn those into confident, structured reports. Here's the key. We're not just rewriting these magically. We're using a repeatable framework to help describe what we saw step by step. That framework is SPEEDS. So we break it down into size, shape, position, echogenicity and echotexture, edge, distribution of any lesions, dynamics, and sampling. Each part gives you a prompt, and when you follow the prompts, your report becomes clearer, more confident, more useful. So let's see how SPEEDS helps us improve some common reporting phrases. This first example is a normal kidney, and before you might write kidneys NAD. After thinking through the SPEEDS prompts, you might write left kidney identified in normal anatomical position. It measured 3.63 centimetres in length, which is within reference range for the species and weight. Kidney expected shape with clear corticomedullary distinction and margins smooth and well defined. No focal lesions or abnormal regional changes seen, no pileptasia or nephroliths, normal renal architecture preserved, sampling not performed. You've just described size, shape, echogenicity, echotexture, edge, distribution, dynamics, and sampling. A SPEED structure makes this normal finding robust and reliable. What about if we don't see a structure that we're expecting to find? What do we do then? So in our second example here, we have a left limb of the pancreas and it's not seen clearly. So before you might have said pancreas not visualized, if anything. After, you would say left limb of the pancreas not confidently identified, stomach, spleen and transverse colon landmarks obtained and no mass effect in this region, abnormal echogenicity or peripancreatic fluid were not noted. Here we're showing position with the landmarks for the left limb of the pancreas, so what you did find, the echogenicity and the dynamics, all adding transparency and clinical context. In example number 3, we have a liver which is diffusely hypoechoic. Before, we may have said liver within normal limits if we weren't sure. After, we can write liver normal in size and position with smooth, well-defined margins. Parenchyma appears diffusely hypoechoic with prominent portal vein walls, creating marked contrast. No focal lesions or abnormal distribution seen. No biliary dilatation or other dynamic changes observed. Sampling not performed. SPEEDS lets you walk the line between confident observation and careful uncertainty without being vague. Our last example, we have an enlarged prostate in a male-neutered dog. Before, we might just have written prostate enlarged. After using the SPEEDS framework, we can say the prostate was markedly enlarged but in normal anatomical position. The shape was preserved. Parenchyma heterogeneous with one well-defined anechoic structure suggestive of a cyst with acoustic enhancement, and one region of hyperechoic mottling. Margins were smooth. Changes distributed throughout the gland. Doppler not assessed. Ultrasound-guided prostatic wash performed, and the diagnosis was urethral carcinoma. This captures a full clinical picture, not just a guess. The difference here, you've just gone from a vague description to a structured clinical narrative. That makes decision-making easier for the next vet involved and for you making your next decisions. So how do you go from writing WNL to producing something structured, confident, and clinically useful? You need 2 things. You need a framework to guide your description. You've just seen how SPEEDS helps. And you need a way to practice and get feedback without fear of being judged. And that's exactly why we created FOVU Report. It's a tool designed to walk you through reporting structure by structure, using SPEEDS prompts to help you notice more, say more, and feel more confident that your report reflects your actual scan. But here's the best bit. It's not just a tool, it's a part of a wider system to help you grow. If you're watching this after January 2026, you can head straight over to fovu.co.uk and access a free trial of FOVU Report. But if you're watching before then, there's a unique opportunity. We're beta testing the tool right now, and our next early access group will be inside the October 2025 Basics cohort. So if you want to help shape the future of general practice ultrasound reporting and get support from us while you learn, come and join us in the next course. You'll use FOVU Report alongside your training, practicing scan descriptions as you build your skills. And every time you upload a report or a scan, we'll give you feedback. You will grow in your language, in your pattern recognition, and in your clarity. No more obvious or maybe, just real progress. Before we wrap up, I want you to do something. Go back to those first few scan images from the start of this video. Pause the video. Ask yourself, how would you write them up now using SPEEDS? What extra details would you include? What would you feel more confident describing? You don't need to be perfect, but if you already see a difference in how you think about these scans, that's growth, that's progress. And that's exactly what we're building in the FOVU Club with FOVU Report. So if you've ever written a report and felt that nagging sense of doubt, did I describe that well enough? Was I clear? Would someone else know what I meant? Then this is your moment to shift that. Structured scan reporting isn't a nice to have, it's how we communicate clinical thinking, it's how we track change over time, and it's how we advocate for our patients long after they've left the room. Whether you're just starting to report with SPEEDS or you're looking to sharpen your confidence and your language, you will find a home for that inside the FOVU Club. Start with the basics course if you want full support and early access to FOVU Report. Or if you're watching this after January 2026, then head to fovu.co.uk to start your free trial of FOVU Report today. And wherever you are in your scanning journey, remember this, you don't have to write perfect reports. You just need to write better ones, one scan at a time. We will help you to get there. Make sure you're subscribed for next month's video. We'll be exploring how confident scanners think differently and how you can train your mindset, not just your eyes, to make better scanning decisions. See you there.